When I was diagnosed with breast cancer about 1.5 years ago, it came out of the clear blue.
I was diagnosed with breast cancer in 2011.
In 2010, in June, I was diagnosed with breast cancer with bone mets.
I was not expecting it. I had no known factors.
First of all, you never know when you're going to need such support.
And the financial load with cancer is unbelievable for so many ladies.
And if these women are in a situation where they need the care, Women Helping Women is an option for them.
I was one of a handful of people that ended up having a problem with the insurance. And I was getting bills anywhere from $4,800, $5,000 for just 2 months of visits with the doctor. That meant that by the end of the year, the savings that we had accumulated to be able to retire on and live off of would be gone.
Imagine being one of those women in this community who is not financially able to pay for her health care.
And so many times women who don't have resources are reluctant to seek medical care.
Then I called the doctor's office and I said, I'm really sorry, but I won't be coming in anymore. I had actually chose to die, because I was going to die anyhow, I figured, than to put us in that kind of debt. She said, oh no, you're coming in. And I said, no, I've made this decision. And she says, what is wrong? And I told her it was the insurance. And so she said, well, you're coming even if I have to come and get you. And I came in and she said, here's a number to call.
Put yourself in her shoes. And what would it look like for you?
I have women all the time say, if I didn't have this fund, I wouldn't be able to get the medical care that I need. I would just have to forego it.
So it's only been a few days that I've actually known it was Women Helping Women that gave that monies for me to be able to make the choice to live.
We have helped nearly 1,000 women since the inception of our fundraising efforts and the Women Helping Women movement.
Had she not done that, I wouldn't have spent our life savings on me for that reason.
You're not just left to yourself, you're helped along the way.
It took me being diagnosed with breast cancer to fully understand the significance of supporting this wonderful organization.
Without a doubt, the Pardee's Women Helping Women is a program that provides direct impact on the patient care and on the health care of women in Western North Carolina.
Women Helping Women has directly helped many of these patients over the years pay for their medical bills, as well as helping the hospital purchase equipment that is up to date.
This gives women the opportunity to have mammograms that maybe would not otherwise have mammography. It allows us to identify breast cancers at an earlier stage.
Early detection is the very best thing that we have to fight against breast cancer, because the earlier that we catch things, the better that the outcome is going to be long term.
It saves lives. I think it also clearly allows patients more favorable treatment options, less radical surgery, more minimally invasive procedures.
Having cancer alone is a battle and a stress you don't want to have to suffer. Never would have thought I would suffer. But to put the stress of bills and those kind of bills.
And that's when I think you begin to see the importance of an organization such as Women Helping Women.
I realized that Hendersonville and Pardee Hospital, in initiating the Women Helping Women movement, have lessons to teach the rest of the country.
You know, if I had something I wanted to say to Women Helping Women, it would be thank you. It's a priceless gift. It's a gift you can't even imagine for people that receive it.
There are lots of ways for the community to become involved through attendance, as I said, the dinner and the luncheon, or just by making donations, and donations of any amount.
This fills a gap that absolutely gives us up-to-date medical care in this community without patients having to go elsewhere.
We take great pride in what we do here at the Elizabeth Riley Breast Center, and we've actually received several national designations that aren't just for us to tout and say that we do things great, but to show our patients that we really are engaged and that we care.
If it's women helping women that's doing it, then I thank each person that has given, because they're the people that gave me the chance to go from dying to living.